Hello and welcome. I'm Joanna Junak and this is GFN News on GFN-TV. The French government may ban disposable e-cigarettes, which are popular mainly among teenagers. François Braun, the health minister, has recently said, "I'm in favor of banning electronic cigarettes, puffs, because they bring a young part of our population to smoking." What will be the next step of the French government? Joining us today to discuss the vaping and smoking situation in France is Claude Bamberger, president of the French Independent Association of Electronic Cigarette Users. Hello, Claude. It's good to see you on the program. Could you briefly summarize the rules on smoking and vaping in France?
Yeah, and it's something important because it differs, not that much, but it differs from some countries because it's linked to other regulations in France. So, beginning with smoking, the selling cigarettes or any tobacco in any form to people, to minors globally, and the majority in France it's 18. Cigarettes, alcohol, pornography, all those are regulated. It shouldn't be sold. So there are those. And for tobacco and alcohol, it went together. There was a first version, and then the actual version, it's quite standard. And it's an important thing to remember that it's not forbidden for minors to smoke. It's forbidden to sell cigarettes to them. We've got the plain packaging. We did nothing, but we've got it. We don't have ads on. It has been for a long time now. So you don't have any ads for tobacco in any form in newspapers, in the medias, in the streets, including in the shops. Another thing, it's quite specific to France. Tobacco has been sold as long as I was there. It's sold by authorized shops, by private customs officers. So the people selling tobacco have a contract with the customs. They are officers of the customs, but they are private people. So basically, it's a group of you go to these shops to buy tobacco. Basically, they also sell other things. Often they sell magazines, newspapers. Some of them also are bars on the bar restaurants as well. It's very specific, and they sell to minors a lot. Last statistics was 70% of them sold to minors down to 12 years old. Concerning smokers, it's forbidden to smoke in collective indoor spaces. And it has been like that for, I think, 20, 30 years now, 40 years. So in the office, in any companies, in indoor space, it's forbidden. In public spaces as well, like restaurants or movies. There are now some open spaces that are forbidden to smoke in, like schools, parks, some sports stadiums, and that's increasing. We have had campaigns against smoking for decades, and now, let's say, it has been 10, 15 years now, we've got campaign to quit smoking. and they are shifting the message, which is good. We've got a steep tax increase in the last decade from around €7 a pack of cigarettes when I quit. I remember it was around 7. It was already going up from 5 in the 5 years before, and but now a pack of cigarettes is between 10 and €11. So basically, we are in this price issue. For tobacco, we are leading in the price the current Europe without UK. Basically, it's the most expensive cigarettes in Europe, not at all the lowest smoking rate. Vaping is quite different. It's also forbidden to sell to minors, but it can be sold by anybody in a specialist shop, of course. People, those shops selling tobacco also often sell vaping products now. They didn't at the beginning, but now most of them do. But you can also sell vaping products in a supermarket if you want. It's not often seen, but in smaller supermarkets, sometimes in supermarkets with aisles of other products, they try to do that sometimes. Ads are forbidden except in shops, physical or online. It's forbidden in planes, in trains, in buses, everything that moves where there are people. And in collective offices, like if you work in an open space, you can't vape legally. But if you work in an individual office, you can vape.
How many French people smoke and vape?
We are the champions. We are leading Europe in smoking. Basically, we can say in 2023, we probably are around 15 million. So basically, the scale, France is 55 million adults, 67 million inhabitants. So we've got 15 million smokers, including 30 million daily adult smokers, which is 30%, around 30%. I say that because of the accuracy of the stats on the trends. Basically, we're around those figures, which is 30% smokers, 25% daily smokers. It's the daily smokers is going down really fast these recent years, this decade. It was really stable, and the smokers percentage is really, really stable. It has been 30% in the 90s, and it's 30% now. But less and less daily smokers. It's really very new in France. The daily smokers are going down in the last decade. The other thing which is going down is the smoking rate at 17 years old. We don't measure minors with adults. The last statistics was 15%, down from 25%. So in a decade, it went down from 25 to 50. It's huge. And it's continuous falling of smoking rate in teens. We now have around 2.2 million new ex-smokers in the last decade. So basically, it's a very complicated issue, counting smokers, because you get people coming in, people going out. We spent years with people quitting smoking but going back. So the figures didn't change for nearly 10, 20 years. It was going slightly down. They were smoking less cigarettes, but the smokers' figures didn't change even the daily smokers didn't change a lot. We've got a lot of generational issue because basically men are smoking less and less, and we already measure steep decrease in lung cancers in men. But at the same time, women and let's say 30 to 50 years old women are going up in smoking. So basically, we have more and more women smoking. It's nearly equality now. In the same time, we've got, let's say, some figures differ, but we've got around 3 million regular vapers. The difficult thing with vaping, I prefer to remove experimenters, people trying, because it really depends on the trends. But we've got 3 million regular vapers, and they are not the same people every year. It's a movement. It includes around 1 million exclusive vapers, regular exclusive vapers, plus 1 million, not in the 2 million, plus 1 million ex-vapers, still ex-smokers. So basically, in the last decade, there is a sweep. We've got people beginning to vape. Some of them go back to smoking. It happens, of course. But some of them become exclusive vapers. Some exclusive vapor become ex-vapor, ex-smokers, and keep being ex-smokers, which is the really new things. Basically, you get 2 million new ex-smokers, 2 million ex-vapers or vapers, but who don't smoke. It's huge, huge change.
The French health minister said that disposable vapes were very popular with youth and that they should be banned. Why are these devices so popular among young people?
Let's begin by the new health minister, because the one before him was a supporter of vaping, not a lot in his actions, but in real life. The thing is, it's not. The thing is saying something that is said by some people and some activists. For the moment, you see teens in high school mainly. You see teens vaping, and they've been vaping for quite a time in France. But it's going up with puffs. Yeah, but they were smoking the year before, and they are not the main buyers of puffs in France. Not sure in other countries, but they are not. Basically, when you count how many people buy how many items, they probably are not the most important population, and basically they are certainly not the most important client in money. That's the first thing. The health minister is focusing on young smokers are using puffs, are using vape as well. Young people in general are trying on the puffs of their friend or things like that, of course. But they mostly trying. The thing is, they are still 5% regular vapers at 17 years old, at the end of high school, which is not at all the 15% that are smoking, which is not at all the 25% that were smoking some years before. And basically, regular vapers, with puffs or without, are mostly ex-smokers or smokers. the percentage, and it has been for 10 years, the percentage of teens, regular vapers, who never smoked is 0%, and has never been anything else than 0% in France, meaning less than 1%.
And what do you think about the minister's proposal?
It's a complex thing. It's a really French thing. The thing is, this minister is just listening to people we know quite well that are relentless with the same talks for a decade without any proof. They just, yeah, we risk that and we risk people smoking more. Yeah, but they don't smoke more, they smoke less. Yeah, but we risk this thing and that thing, and now they are fighting for nicotine addiction, which is a lifetime horrible thing. Don't remember, it was horrible. The thing which is horrible, it's the consequences of smoking, not using nicotine. So he's listening it because it doesn't care. It's sad to say that of your health ministry, but it doesn't care about smoking at all. The more horrible thing is all the whole government program on public health, on health care in general, is based on prevention. The same minister didn't know the number of people dying because of smoking every year in France. He didn't know. It means he doesn't have any interest in the subject, which is the first cause of avoidable death in France. He doesn't care. So basically cares about money, and that's an important subject in healthcare. And he has many, many issues with money in healthcare in France. I think the public part of healthcare was nearly going down economically before COVID, with hundreds of billions of euros that just made it stay up. But we still have many, many issues in healthcare. And now we've got issues with private professionals, health professionals that are asking for more money. You don't change our prices because the prices are fixed by the state. You haven't changed our prices for more than a decade. So basically, you've got public health professional and private health professional nearly in the brink of well, they don't do real strikes. They continue to work on strike, but it's a big issue. So basically, I think the money is the main issue, and smoking in France is paying a lot of money to the healthcare budget. Currently, it's around 17 billion.
Thank you, Claude. Looking forward to seeing you in Warsaw this June. That's all for today. Tune in next time here on GFN-TV or on our GFN-TV podcast. And don't forget to register for the Global Forum on Nicotine conference taking place in Warsaw from the 21st to 24th of June. Thanks for watching or listening. See you next time.